Welcome to Accelerate Your Dental Practice, the show for dental professionals ready to grow smarter, faster, and stronger. Hosted by Michelle Affinato of Affinity Management Consulting and Malika Azargun of Czar Dental Consulting. Each episode delivers practical strategies and expert advice to help you streamline operations, increase profitability, and reduce stress. Let's get started.
Welcome back to Accelerate Your Dental Practice. Super excited to be here with Malika for our first podcast of 2026.
Right?
I know, I think back and I'm like, what? I feel like we just did the first one of last year. It went by really fast, really, really fast. So today we're going to talk a little bit about case acceptance. And one of the things that we've been coming across lately is, doctors frustrated because their case acceptance isn't where it should be, and teams being a little bit frustrated because they don't fully understand the expectation for the case acceptance. They don't understand the procedures some of the time or how it's supposed to be presented. So ultimately, when it comes down to it, case acceptance is selling, whether anybody wants to say that dirty word or not. It is selling. But when you don't have high case acceptance, many times it's not because of the sales process. It's the leadership and the guidance for the team that is doing the selling for you. So we're going to dive into that a little bit to maybe help you with some tips and training for your team to increase your case acceptance for this year.
Yeah, and I think you nailed it, Michelle. A lot of times when I go into my client offices, they're telling me that my treatment coordinator doesn't know what she's doing. And can you please help her or help him? And a lot of times when I have a sit down with these team members, a lot of times they're like, well, we don't really know what our doctor wants. Patient comes up front, we're getting miscommunication. One treatment plan, he wants this. The second treatment he wants that is the exact same procedure codes. He's not sure or confident that the patient will agree. So I think, as you said, it starts on the top. The leadership has to have a buy-in and know exactly how they want that delivered so that the treatment coordinator or your front desk that checks out, and depending on the practice, some people don't have a treatment coordinator, and that's okay. I get it. But there's somebody at the front desk that's selling this treatment for you. And if you don't have structure there and you are not believing in the product or the services you're providing and you're not leading it properly, your treatment coordinator is not going to be able to follow. They don't know what's going on.
Exactly. Like Malika said, it starts at the top, right? So as the doctor, as the clinician, it's your job to diagnose the treatment, right? Like your assistant isn't diagnosing it, your front office person isn't diagnosing it, right? It's your job to do that. So every doctor is different. I work with clients and I can tell you I have some that are very aggressive in their treatment plans, and I have some that are very conservative in their treatment plans. I'm not going to say which way is right or wrong because it's your preference, right? That's how you work and you want to treat your patients. That's fine. However, the team needs to understand your philosophy for when you're going to recommend treatment. Because if you do that and your hygienist knows exactly when you're going to say it's a cavity and it should be filled versus it's something that you're going to watch, they can be prepping the patient, right? We're not asking them to diagnose, but if they know where you're going with it ahead of time, they can start planting some seeds for the patient before you come in to do the exam.
Yeah, absolutely. And one of the things that I notice is that, the unsureness of the clinical flow of this treatment planning. And what I mean by that is, most practices have a hygienist. So the hygienist obviously helps with that process. So the hygienist is not, I shouldn't say diagnosing, but as they're doing the cleaning, the probing, taking the x-rays, they might make some comments about, upper right looks like it might need something. I'll have Dr. X come in and take a look. And that handoff from the hygienist to the doctor in that process is the first connection and the bridge in that treatment process. But if you have a hygienist that's really, you don't want them. I have an office where the doctor doesn't want the hygienist to say anything. Okay, it's your preference. I'm not a fan of it, but it's your preference. So then when you come in, you have to do the legwork so that the patient understands clearly from your leadership what the patient wants. If a patient goes up front and the treatment coordinator says, okay, looks like you need a crown on tooth number 15, and the patient goes, what? I need a crown? The leadership is broken. It is not your front desk or treatment coordinator's fault that that crown didn't convert or get scheduled, because it really starts in the back, as you said, in the clinical side. So if the clinical is not being clear about what that patient wants, don't accept your treatment coordinator to convert that for you, because the system is broken. That flow didn't happen properly. And now the front desk is trying to now explain a whole crown to this patient. And the patient now says, well, can I speak to Dr. X? Dr. X has already moved to the next patient. You know, it's like a domino effect. And guess what? If I'm that patient, I don't know if I want to schedule, because I'm kind of like, do I really need that crown? The doctor now needs to tell me again. It must have not, there's no sense of urgency for that crown anymore. And then that patient now gets on an unscheduled list and most likely will not even consider it until their next 6-month recall, when it's asked again or treatment planned again in hopes for them to get on your schedule.
So I look at it this way, Malika. I take a look and say, basically, dentistry is sold chairside, right? It is the clinicians, the hygienist, the doctor, and even the assistant to diagnose, explain, and reiterate, right? You guys know the reasons why. So in chairside, you should be creating like, this is what is needed, then talking about the value of having this done, the benefits of having it done, like getting this done now versus waiting is going to save you money and chair time, right? A simple crown, if they wait too long, could end up needing a root canal, could need a buildup, could need extraction and implant down the road if they wait too long, right? So creating the benefits of getting this treatment done and why getting it done sooner rather than later. And then creating a sense of urgency. I have a lot of doctors that feel weird giving patients a buy when date. Like a lot of doctors are like, whenever you're ready. When you say that, you're setting your front office team up for failure.
Yes.
In terms of scheduling, right? So you have to set a buy when date. I love to use this method. Every month has a holiday. So I like to say, like, I'm concerned about this tooth. I'd like to see you get this done before Valentine's Day. So now I'm saying, like, you got a little bit of time, but not too much time.
Right.
If it's not that urgent, be like, okay, great. I'd like to see you get this done before Easter. So we're using a buy when date, which helps your team. You know, Dr. X was really concerned about this tooth. There's a crack in the tooth, you know, there's recurrent decay. We're concerned that it could break, and it always breaks at the most inconvenient time. So we'd really like to see you get this done before Valentine's Day. Now Valentine's Day kind of sticks in your patient's head. And it's also a great resource for your team to use if the patient tries to cancel. So think about yourself as the owner who wants higher case acceptance, and as the clinician. If you're not doing your job, creating the value, the benefit, and the sense of urgency, you're not setting up the treatment coordinator, the front office person for success in their role.
Yeah, very true. And I think to add to that, that communication of, let's say, the holiday benchmark, the sense of urgency, there needs to be a training and communication between the front and the back to know that, so that when Joe Smith goes up front and it's February and it's Valentine's Day is coming up, the team in the front already knows exactly what the doctor's tactic is in the back. So they're like, Dr. X would like to get you in before Valentine's Day. Let's go ahead and get that scheduled. And they know not to ask a question, just get it scheduled. But if they don't know what you're saying in the back, they're going to do their own way of things. And then the patient then gets confused. And I always say, you want to be in the driver's seat with your hands on that wheel. The minute you give the control to your patients, sit back and you will never get anything done. That conversion won't happen.
Exactly. And so basically you're setting it up, right? The dentistry is sold chairside. You want that patient walking up front being like, oh my gosh, I have this big crack in my tooth and they said I had to get it before the Valentine's Day. Like, let's get me in. And yes, the front office, you still have the financial barrier, right? The hurdle to get over. But if the patient fully understands why this is needed to be done and why it's in their best interest to get it done by Valentine's Day, it's more likely that the front office team member or the treatment coordinator will be able to come up with a financial arrangement that suits both the patient and the practice, right? So they're kind of the closer, right? You set it up clinically and the front office team member closes it.
Right, right.
And I find because a lot of front office team members don't have a clinical background. So if you don't do your job clinically and the patient comes up and starts asking a whole bunch of questions to that front office person, it really looks bad when they have to get up and down and call the assistant back or call the doctor back to answer these questions. They should be answered before the patient is dismissed from the
Right.
operatory.
Right. I always say, like, think about the time because we all go through this. And I hate to say it this way, but think about the times you go to see your physician, and I vent about this, and I know others do, that you feel like you can't even get a word in because they're in and out of the room. Dentistry is different. I know you guys can spend the time with the patient. That's what makes it stand out. Because a lot of times my conversations with friends and family is, I wish physicians could spend the same amount of time that my dentist spends with me. And for that reason, that time that you have, you should be able to explain what is the why behind why you need a crown or root canal or whatever it is. If you're periodontist, I need to do surgery, pediatric, why your child needs to be, the child needs to be sedated, whatever it may be. And also be able to follow up and say, do you have any questions I can answer before I send you to the front for Sarah to schedule you with me? So that way you're given that opportunity and your team knows that that is your structure and your system, so that when the patient comes up front and challenges the front desk and says, well, Dr. X just kind of rushed out of there, I didn't have a minute to ask, then your front desk can do what? Say, well, I'm really surprised because I know Dr. X definitely spent some time explaining that. Let me get up and see what's going on. If there's an issue, they can get up versus what you exactly said, Michelle, like getting up and going. Like sometimes I'm in an office, I'm like, oh my God, this poor girl has gone in the back like 20 times. And there's a disconnect in that flow of conversion. Imagine a time that you have gone and bought a car. If that salesperson keeps going and saying, oh, I'll be right back. Oh, I'm not sure if those brakes have warranty on it. Oh, I'm not sure if you can get it in blue. As you said, I hate to use the word sales, but dentistry is sales. And if you can't have a flow, the conversions percentage keeps dropping because there's a disconnect between you as a leader and your team in the front desk.
And the selling, Malika, it's not just the services. It's selling you as the provider to do it for them. Like,
absolutely,
why should they have it done? So if you have all like a nice flow and the communication is great and you're educating that patient, they walk out and be like, yeah, I feel so comfortable with them. Like they've explained everything to me and they went over, everything and they seem to know what they're doing. They're going to do it with you because remember, there's a lot of options out there. And if you don't look sure of what you're doing, they'll call somebody else. They'll go for that second opinion and they might get the work done somewhere else, regardless of whether it's cheaper or not.
right.
So you're not just selling the crown itself, you're selling yourself as a provider to do those services.
Absolutely. And I want to add something to this because I think this is really important. And I unfortunately see this a lot. Giving courtesies. Have structure with your courtesies. I'm not saying don't do it. First of all, anything that doesn't have a dollar amount or value to it is not appreciated. I keep end of the year with my clients, I say, let's see how much courtesies you had done in 2025. Because sometimes they forget how much they give away. And I'm as a business owner, it's a good feeling to give away or give courtesies when it's needed for the right reason. Family, friends, if you have military courtesies, whatever it may be. But please make it structured because your front desk your TCs get so confused because one friend gets 15, the other friend gets 25. One non-insurance patient gets this. You have to have a clear protocol for this because that also causes a gap in that conversion. Because when your front desk is confident in the fact that in the back, you've told the patient, you know what, Joe, we've known each other, our kids go to school together, and I'll make sure that since you don't have insurance and we have a non-insurance plan, courtesy plan, you will get 15%. Do not fluctuate that to 25. I don't even want to go to the legal part of it, but for the confusion part of the team, that is so messy. Or they come up front and the patient says, well, Dr. X told me I get a discount. There's nothing on the router. There's no handoff or nothing in the chat that you guys have between the front and the back. What does that poor girl have to do? Get up, go to the back, try to get the doctor's attention that's probably already in the next patient's mouth. The flow is broken. So I think that's another piece that really comes from leadership. What is that protocol? What is that you want to do? And it's something that you can keep consistent. Sometimes you give too much and then you don't want to give anymore. And those patients are like, well, last time I came, he gave me 50% off. Why can't I get the same thing? Think about that stuff before you do it. That's why I recommend it to be structured. If you have a military discount, what is that? If you have a senior citizen discount because you're fee for service and you want to have that, more power to you. I have nothing against it, but let it be structured because it just helps your practice look better and more organized, and it helps your team convert for you a lot better.
Yeah, it should be in writing, clearly defined, right? Everybody should understand it. And yes, you're the owner of the practice. You're the doctor. You can make exceptions, but if you do, that has to be clearly communicated as well. And it needs to know like this is a one-off thing. This was only happening for this particular visit.
Right.
Because I do see this a lot. Like I've even seen it, there's no system in place and the team members just make it up as they go along, which
that's scary.
that's a whole other episode that we can talk about.
Oh, yeah. Oh, yeah.
Another
this right now that just like I run some reports and I'm like, hold on, why is this courtesy? And the client's like, I had no idea. I don't even know. Well, you just allowed your front desk just to call the shots, and that's a mess. You just, he or she just gave away the house because they felt bad for the patient because you don't have a protocol in place for it.
Exactly. So another avenue I kind of want to discuss here is I love it, absolutely love it when doctors take CE and want to implement new services, new equipment, new things into the office, right? However, if you take that CE by yourself, or even if you bring one team member with you, you cannot come back from your weekend course and say to the team, hey, today we're going to start Invisalign. Start telling patients that we do Invisalign and I expect to sell 4 cases a month. That's not going to work. And I see that it happens all the time, right? What I think is really, really important, and I actually have a client right now that I love. This is what she did. She's been taking some Invisalign seminars, right? She's part of some track or whatever. So she does in-person seminars, but she also has online training for herself. And then there's a team track. In November, she said, we're going to start doing more Invisalign. They were always doing it, but she didn't feel like the team was on board. So she said to them, you have until January 5th to watch all of the videos, come to me, ask questions, because starting in January, we're going to do this. So she's been doing some trainings on her own, having conversations with the team. They're required to watch all of the training videos so they know how to have conversations about it. They know what the appointments are going to look like. They know how to discuss finances. They are very well prepared to implement this new service in the practice. But I don't see that a lot. And that's a leadership quality. You cannot come back and expect, if you just like, hey, I took a course here, I want you to start building this. There's so much that goes into it. And if you don't have a confident team, it's not going to work. It's not going to 100%. Work. And I understand you come back and you're excited and you want to hit the ground running with it. But if you only tell one person or you don't tell anybody that you're doing it, the team is not going to look great to the patients because they're going to be like, is this the first time you're doing this? And it is. So make sure when you do that, you have time to come back, train your team properly, discuss it with all team members that are going to be involved before you just come back and be like, we're doing this now.
One of the things, Michelle, I remind my clients on is that your team has to believe in what you do in order to be able to sell it for you. I use the analogy that I believe in, or at least when my kids were especially younger, the Disney cruise, that Disney was my thing. And then my friends used to joke and say, like, I feel like you work for Disney the way you talk about it. Do you get a cut? And I'm like, no, but the experience is so great. I saw the results. I knew how great it was that I talk about it. So I think, the team needs to see before and after or hear the difference the dentistry has made in people's mouth and their lives in order to believe in it, to sell it. So Invisalign is a good example that you brought it. Show them before and after to your entire team during a meeting. Show an X-ray of it before with, a cracked tooth versus after. Someone grinding and then getting a night guard. Bleaching for pre-wedding and someone thanking because their teeth look so great. All of that gets your team to buy in and want it for everybody else. Because if they don't know about it, as you said, you cannot expect these people to sell anything for you because they don't know anything about it. They don't know what Invisalign is. In their mind, you know what they think? They think, oh God, all he wants to do is just make money, and the patient doesn't even need that or doesn't even want that. But if you educate them, or like Invisalign, like you said, if you are doing something like the Molus program, or you're doing the Invisalign videos, whatever you may be doing, if you have your team watch them and give them a deadline and discuss something, or say, hey, come back with 2 pearls each about what you learned about Invisalign, that gets everybody interacted and understands the why behind why you're bringing Invisalign into the practice, or why you guys are doing implants, whatever it may be. But if they don't know, you can't just flop a treatment plan into the computer and say, print this, present this. It's very robotic. The conversion won't happen.
Right. And you said something, a key word there, Malika, was buy-in. Your team has to buy into what you're doing. If they don't believe in what you're doing, they're not going to be able to sell it for you. They just won't.
Yeah, no, they
So you
won't do it.
also have to look and say, do I have the right person or the right people in place? Because I've seen some people who are amazing at general administrative duties, answering the phones, scheduling appointments, like having regular conversations, but they buckle. They're afraid when it comes to the conversation about treatment and discussing finances. So just because you have somebody that you think is great, you need to make sure that they're right for that role. Because some people, I have run into this where I've had a front office person that was like, just like I explained, amazing, answering the phone, customer services. The patients loved her. But she had this hang up over fees. And she felt that things were too expensive. So when she presented treatment, it totally came through to the patient, and they were like, my gosh, this is expensive. So, if your team doesn't buy in and understand why this will benefit the patient, again, we're talking about the benefits, you're going to have low case acceptance on it, and you're going to continue to be frustrated.
And I say, if somebody already feels bad for the patient, because let's say they're in a bad financial situation themselves, usually they're like, well, I can't afford that crown. I don't know how Mrs. Jones is going to afford that. As you said, it just spills over. That energy goes to the patient, and the patient's like, yeah, and that's too expensive. And what happens a lot of times, the staff says, yeah, I know, I'm sorry. Like, that connection or bonding happens, and that just unfortunately just keeps going. And sometimes it's cancers in your office, and it affects other people in your office with it too.
Yes, exactly. So as you start off this year, right, take a look back. Like if you're using an analytics platform, Dental Intel, Practice by Numbers, there's a ton of them out there. Take a look at what your case acceptance or your patient acceptance was for 2025. And then set a goal of what you want it to be. And at your first meeting, your first team meeting for this year, focus on that. Talk to the team members, ask them, is there anything that they're doing, that you guys are doing service-wise, that they don't understand? Is there anything new you want to implement that should be explained to them? As Malika was mentioning, like the handoff in the clinical, like the hygienist prepping the patient and letting the doctor know what's going on. Work on those things. And if you have a smooth transition, your case acceptance will go up.
100%. And one thing I'll say is, I challenge you to ask your team member or members, whoever presents treatment plan, to make a note of the why a patient has said no to a treatment. And at that meeting, discuss it. I know sometimes we just don't want to know, we're hiding from it, but let your team member tell you why, so that you can look within and see, is there something clinically in your communication or your handoff that could be done better to help with that conversion? Because remember, like we said today, the conversion happens from the back to the front. So if the right information is not shared with that patient and that leadership's not done properly, your front desk can't convert. So if your TC comes back to you and says, these 3 treatment plans were not converted because patient's confused and didn't know that he or she needs all this done, you guys kind of have to go back to the drawing board and figure out what's happening in the back that's making this happen. Because you can't quickly just point fingers to your CC, as Michelle said. Like, I get this call all the time. I think I need a new TC. My TC can't convert. And a lot of times, it's not the TC. It's really from the leadership side that needs to be better in order for the TC to be set for success.
Exactly. And with that, thank you for joining us today, and we will see you in the next episode. Take care.
Take care. Bye-bye. Yeah. I'm trying to see if our next one I could bring a guest. We talked about a couple guests. I already forgot who those guests were. I think we talked about a couple of them to bring. Maybe we can bring in.
Thank you for listening to Accelerate Your Dental Practice. To learn more about your hosts and explore consulting services tailored to your practice, visit affinitymanagement.co for Michelle Afato and zardentalconsulting.com for Malika Azargun. Be sure to follow, rate, and share the podcast. And join us next time for more tools, tips, and strategies to help you accelerate your dental practice.